So Angela,
Yes.
let's take on the data.
All right.
I know, I'm like talking in your wheelhouse here. You love the data. You see her eyes light up. You say data, and she's like, yeah. It's like right up there with saying shoes for
Yes,
you.
it exactly is. And, you know, everything in my life I take data on as well. So it's
Really?
just, I do.
Like what?
When I'm trying to cut back on caffeine.
Really? You take
I
data
take
on?
data.
Because it's that reinforcing for you.
It's that reinforcing, and you know what? This is generally for everyone looking at data. You see exactly what is happening and the patterns of behavior, and you know, you can say, oh yeah, I'm cutting back on caffeine, it's fine, but you don't really know exactly how many things you ate or drank that had caffeine in it. But if you're taking data on it, you're like, okay, yes, I had 10 cups of coffee today or whatever.
You know what I find interesting about the data is that when you do take data on things, sometimes there's some things that are shocking, things that you didn't realize. And we all know, we've all had that friend who says, oh, you know, I've cut my calories back, and you're watching them, you know, sneak things in, and you're going, that's not really realistic.
Yeah.
If you're really charting this, it's not really realistic.
Exactly.
So interesting for ourselves and for our kids. I know I certainly have been in the circumstance where I've said, oh, you know, I think that he's not getting better, that, you know, that he's not getting this skill, I'm frustrated, or I say, oh, I think he's got that. And our supervisor, Sabrina Toom, a wonderful woman, would take out the book and go, well, here's what the data shows.
Exactly.
And I go, really? That's what, it doesn't feel that way to me. So very interesting that I always believe in a parent's gut, but sometimes we're not entirely accurate because it's emotional.
Yes. And sometimes the data will show small incremental improvements that you can't see necessarily. Like, you don't see that the child is having a full conversation with you, but we are tracking so many smaller steps, and we can show you, well, yesterday he was only getting 50% accuracy on this, and today it's at 70% accuracy.
Which is progress.
It's very good progress, exactly. And one of the things, though, you want to watch for is that if the data aren't showing anything, you know, if after a couple weeks you're not seeing any improvements, you want to change something.
Right.
And that's really what we look for. We want to see, is our intervention working?
Right.
And that's exactly why we have to track the data, because, you know, especially for a parent, for behavior problems, like if you're implementing something, it seems really difficult for the first couple weeks. Like, oh, he's getting worse. Maybe the extinction burst, like, has come on, and it's just seems so difficult and nothing's changing. But if you look at the data, you say, like, yes, it has gotten better.
Okay.
He had 5 tantrums yesterday, but today he had 4.
Right, and that is improvement. But as you said, sometimes you look at the data and nothing is happening, and then it's time to change something.
Exactly.
But what's interesting to me is that I think a lot of times as parents, we want to change everything. We want to throw the baby out with the bathwater, and what I learned over the years is that it's like Priceline. Do you know how when you're putting something in Priceline and you put in an offer on something and you say, well, I'm flying on this day, I want to stay this long, and this is the price that I'm willing to pay, and Priceline sends it back and says, it's not happening, you got to change one thing. And then you have to go in and change just one thing. Not everything, but you have to change one. Maybe you want to change the area of the hotels. It's like a Priceline ad right now. You want to change the area that the hotels are in, but it's like that. Only change one thing. You don't go in and change everything. You change one thing. And you stop and think for a moment, okay, you know, what needs to be changed for this bid to work on Priceline? And that's what we want to do with our kids. Think for a minute, think, okay, so what does the data show here? What's the 1 or 2 things at the most that we want to change? So talk to us a little bit about when you look at data and some examples of different things that data shows you that you go, oh, this is what we would want to change in this instance. And
Well, specifically for behavior problems, if you're tracking it over, you know, a week or 2, and you see that there are spikes, so there are increases in behaviors, certain days, certain therapists, even, you know, when there was an outing or something, we definitely want to look at those things. So everything around why there are spikes in the data or increases or decreases. So we really focus on the environmental factors as well.
Cool.
And just looking at the data, we can see a pattern of behavior, but that's not where we stop. We're like, okay, this is the pattern, but why is that happening?
Right. So kind of like a function, looking for the function of. So if you see that every Tuesday afternoon at 4 o'clock you're getting a tantrum, there's something consistent there.
Exactly.
And you got to look at what is the consistent thing there, because it might be something, it might be an antecedent, it might be a consequence, it might be something happening before the behavior or something happening after the behavior, and you would want to change that thing. You'd want to manipulate that. Or it could be a person.
Yep.
Could be, you know, that's what's happening, and which is fascinating.
It is.
I think, and it's not always negative.
No.
You know, so you know, you never want to assume, but you start asking a series of questions based on what the data has shown you.
Also, you were talking about generalization earlier, and sometimes you see that children work really well with one specific person, and that therapist is saying, well, I don't understand, you know, he's doing so well with me, but not with everyone else, and that might be a lack of generalization.
Right.
And so you can see that in the data, because when that person is there, skill acquisition percentages are very high. Behaviors are very low.
Right. And so very interesting to see all of those different factors. You know, and we've talked before about mastery, and we'll talk about more, but you know, a lot of times we set mastery criteria, and you can see when you look at the data, we saw this several times with Jem, that you know, he would have it with one therapist, next therapist comes in, so he would just be missing mastery. And so it was always fascinating to me to see the team sit down and see if they could unravel the sweater and figure out why. And ask the therapist that it wasn't happening with, run the lesson right here in front of us, so we can see. And sometimes it was just like the smallest little thing that needed to be tweaked, and the child could get it. And so worthwhile, so important for our kids that we find the stumbling blocks. And it's there in the data a lot of the times to point the direction of here's where we need to look next.
Exactly. It just indicates to us where there is a change that needs to be made.
All right, we're going to take a little bit of a break. We're going to come back, and I'm going to talk to you about the, you know, we've had a little discussion about this with somebody else before, about when you see, for instance, the child always gets the first trial wrong, but then gets the rest of them, and the what that kind of shows us. So stick with us. We're going to be back more with Angela Persicke after these messages. You were just part of a presentation, and there was one thing in particular that I was interested in hearing about, theory of mind.
It's about having thoughts about other people's thoughts. Can you understand their perspective? And they've developed a behaviour analytic protocol, because the theory of mind literature is certainly interesting and it comes from a developmental perspective, but it's really just that those skills develop and they're there. So now we're like, well, what do we do when they're not there? How do we train them? And they found that they can train it to typically developing kids. They found that when they do train it to typically developing kids, it does shift theory of mind scores. So what my student Dina and I did for her master's thesis was we wanted to look at, can we train it in children with autism? Can we train them to pass this protocol of a number of statements and questions related to the perspective of the speaker? And then when we do that, does it change their theory of mind? And what we found is that actually didn't. We could train it in them. We could train these skills, but that it didn't actually shift their theory of mind scores. So it seems like there may be some other skills in there that we might need to teach between these sorts of relations and the more global theory of mind type of skills. And also the way we have to do with a lot of our behavioural interventions, we really will have to break it down even further for kids with autism and very deliberately program for generalisation.
To know that you guys are working on it lets me sleep at night.
It's really nice to hear those comments from parents, because that's kind of what also drives us.
Welcome back. And so the wonderful Marianne Jackson, who we had an opportunity to talk with in a hallway, literally grabbed her in a hallway at ABAI, and she's somebody who you're very familiar with.
Yes, she was my advisor, one of my professors in my master's program at California State University, Fresno.
And in fact, you were one of the people, she was on my list of people that I was trying to get, and you would kind of look through my list and you were like, absolutely make sure you interview her, she's wonderful. And she was, and I said there at the end of it, when poor Angela didn't didn't get to hear the sound on the interview, but at the end, we were talking about the research that they were doing about solving theory of mind and how to teach child theory of mind and to achieve generalization with that. And I said to her, I said, you know, the fact that you're working on something like this and that people of your level are working on this allows me to sleep at night. As a parent, I mean, it literally does, because for years, can I tell you, I walked the floor around the bed because I was going, what are we going to do? What are we going to do? What are we going to do? And when I know that you guys are working on it, I go, okay, somebody else has this under control. I can take a snooze.
Exactly.
It's a
That's why we're
thing.
here.
Well, it's a wonderful thing, and I can't thank you all enough. And I want to remind everybody at home, because there was a period of time when I just didn't have access to as many BCBAs as I do now, and so I didn't know.
Yeah.
I still am learning. When we went to ABAI, I went, really? There are this many of you? And I'm sure that there were people who weren't there. You know what I mean? And I go, this is crazy. This is wonderful. There are this many people working on it. Fabulous. I'm going to go home and take a nap. So I'm always learning, and I figure if I don't know, then you guys at home don't know how many people are working to find the answers passionately, that get excited and their eyes light up when you say data. I don't get it, but it's okay. It's good. Okay, so let's go back to talking about the data. And for instance, when we see a child and we see on the data, we see some different consistencies. One of them being that, let's say you start doing trials with a child and you're doing trials of 10, and we talked about DTT yesterday. So you're just giving them 10 really succinct opportunities, and you keep seeing that the child's getting the first one wrong or the first 2 wrong, but then they get the rest of them right. What kinds of things does that tell you as a person looking at the data? And maybe not in all circumstances, but what kinds of questions come to mind when you see something like that?
Yes, I've seen it very often, actually, especially with our younger kids that we are just working on discrete trial training with. You know, we haven't moved into naturalistic environment training. So what I notice with that is that they may not know the skill. They may not have it yet, and it's almost like if I asked you a question, you didn't know it, then I gave you feedback, corrected you, and then asked you 10 more times.
Right.
You know, the feedback may have prompted the remaining responses.
Right.
And especially if you're doing that, just sitting, giving those 10 trials, that may be the case, that the skill isn't actually learned yet, you know.
It's more like they're using the short-term memory, because they did the first 2 and you did corrections for them, and then they went, oh, okay, what you want me to do is this, so they did it in the moment, but that doesn't mean that they have it.
Exactly. And in that case, you may want to spread out the trials throughout the whole session. You know, a session may be an hour or 2. If you're just working with your child at home, if you're a parent, throughout the day, ask them once, you know, give them that feedback, maybe ask them again, but then wait. Wait a while.
Right.
Then ask them again later. And that will really indicate if the child knows or not.
Right.
And of course, asking them the next day.
Yes.
And if you're just looking at 10 trials and the child misses the first one, but then gets the rest right, that's 90% correct. And a lot of times that's mastery.
Right. It would seem to you like, oh, well, they're at 90%, so they have it, and yet in reality, the child doesn't.
Yes.
Because they learned that short-term memory from the first one and were able to do it, but it hasn't moved into long-term memory. They don't, I always say with mastery, it's that by George, I think they've got it. And in actuality, in this case, it looks like on paper that they have it, but they don't. And so important that we're actually teaching, not just saying, okay, well, they can do it 90% of the time, but they're actually getting the skill.
And in a lot of our skill acquisition studies that we do, so teaching a specific skill, we look at first trial data in addition to total trials.
Interesting.
And that shows us if it's generalized, actually, especially if we're working on a skill that isn't just identifying one specific color or name, label, but a generalized skill. So, you know, no matter what the target is, the child responds similarly.
Okay.
So, for example, right now we're working on teaching children to attend to socially important stimuli. So if someone says, ouch, they look towards the person and say, what is it?
Right.
But they can't only do that when the person says, ouch. It might be, oh, or look at that. Or wow, or anything like that, or a gasp, or they're coughing. You want the child to look and see what's wrong and be interested in what is going on with that person. So we're working on that right now, and we're looking at the first novel trials. So in a session, we introduce new exemplars, and we see, okay, are they getting it when we introduce something new?
Right.
Has it generalized? And in our graphs, you'll see the training trials may be high, 80% or above for total trials, but for the new ones, it's a little bit more of a learning curve.
Right. So it just takes a little more time, but that doesn't mean you give up on it.
No.
You just give them more opportunities, and again, that back to that Priceline thing, change one thing, but that you're not just leaving the status quo.
Exactly.
I always talk about the definition of insanity is doing the same thing over and over and over again and expecting a different result. So you do have to tweak something at some point, but not the whole thing.
And you'll see this sometimes when you're starting out, and sometimes with agencies that aren't as in tune to using generalization and programming to generalization. Sometimes you'll see this where they just do a lot of discrete trial training over and over. That the children, it's like they're programmed to answer that specific way, and even down to how are you? And they say, I'm fine. Every single time.
Which is frightening to me. And we know that with the advent, the great thing that we have insurance reform and more people have access to insurance, it means that some people are, there's some great ABA providers out there, great ABA providers, but there are going to be some people who are not as knowledgeable and not as interested in doing the best possible job. I wish that weren't the case. But I think it's going to become more important now for parents to be able to discern the difference between am I getting quality ABA? And that's one of the big things.
That's huge. Generalization. You want to make sure they're programming for generalization. You want to make sure they're taking data. If they're not taking data, they can't accurately show that the child is learning anything.
And I think with insurance that everybody's going to be forced to take data. So even if there was somebody who was out there who wasn't doing it, they're going to have to take data. But here's my next question for you. One of the things that I learned early on is that the data is only as good as the person who takes data the least well on the team. Excuse me. Because it's not a skill that everybody is as good at. That there are always going to be somebody who's a little less specific, and I do think as a parent you need to know how to take data, and you need to know how to look at the data and have an idea, just to be able to recognize, because if you're seeing, and it can go both ways. Let's say that you've got a therapist who comes in and it seems like they're getting 90% across the board and they're doing just a fabulous job, and you see another therapist that maybe the child's at 30%. And you might think, oh, well, the 90% therapist is really the awesome therapist, but it might be that they're taking data in a way that it's making it look like the child's getting it when the child isn't.
Exactly. And a lot of times we'll break skills down and include prompting and saying, okay, with this level of prompting, we'll consider it correct. And if a therapist is including more prompting and not counting that the way that the team decided to count it, they could be saying, oh yeah, this child has this skill, but the child may be prompted. Exactly, and they may be prompt dependent at that point.
So important. And for each lesson, you decide what the correct response is, right? And I always tell you guys, if you've got therapists that are coming, be in the other room with the video monitor and have the sound on. You may not be able to sit and watch every single moment, but you can hear every single moment, and I'll tell you, you will get better. You will understand more because you're constantly hearing it, right? And there were different therapists that would come to my home that I would sit and watch the monitor compulsively because they were so awesome. And I wanted to learn, and I wanted to watch, and I wanted to see my child learn. I would get so excited. From time to time, they'd be out in the room and they'd go, yes, and they'd hear me in the other room going, yeah. because I couldn't help it. And then there were other times where there were therapists that I thought, I don't know, and I want to be watching to see, what now at CARD, overwhelmingly, we just had rock stars. We just, but it's still, I have to tell you, you gotta watch. And every therapist is not a perfect match for your kid or your family either, and we shouldn't leave that out of the conversation. But watch and see, if you're seeing discrepancies in the data, because it's only as good as the least effective person on the team. And the data, if the data is not correct, I love in CARD learning, if you get the opportunity, I hope you guys are all doing CARD learning, and there's this wonderful voice, this fabulous woman who has a much more soothing voice than I do, and she says, this is how you want to teach the child this, and it's this very, friendly voice, but there are a couple of different times, and one of them where she's talking about taking data and teaching how to take data, and she says, if you're not going to take data, then you are not helping the child, and you should stay home. And you just go, she's going there. She's like, it is not acceptable to not take data. You are not useful to the team. You are not helping the child, and you should stay home. and I loved that as a parent.
I know, it's great.
I just was like, well, that's the truth. Way to lay it out there, fabulous, very even Buddha voice.
Exactly. And if like sitting in the other room too, you can take data yourself and practice and
compare.
Exactly. And that's what we call inter-observer agreement.
Oh, new jargon.
Exactly. Inter-observer agreement, or IOA, is when two people take data separately and we get a percentage of how accurate they are.
Love that. So what a great way to learn taking data. And if you feel like your ABA provider is not taking data in the way that you want them to be able to judge and say, discrepancy here.
Yeah, and sometimes, a therapist will run trials really quickly in a naturalistic setting, and will think, okay, I'm going to remember this when I go to write it down. And you can't accurately. It's very difficult. A lot of times I would use sticky notes and just tally. But that's always something to watch out for too. If the therapist is engaged in their session and doesn't have a data sheet, check the accuracy, because it's not always what you remember it to be once you go back and write in the data.
And this is actually a wonderful thing that at some point I got to bring in a bunch of therapists and kind of interview them and talk about, because over the years we saw people take data in so many different ways. And as important it is to take the raw data and then graph it, and people did that in different ways too, that all the therapists who came in, and even if we went on a play date or went someplace, there was always the piece of paper in the pocket, and they'd be marking little hash marks to realize, and doing it in a very discreet way so that everybody in the world, there were times early on when I said, bring the clipboard, I want the data, I don't care if all the other moms at the play park freak out, bring the clipboard. Later on we got more discreet about it, and some people are better at the discreet than others, but
well, even one of those clickers, golf clickers, counters, and those are really easy. You just click it. And you can go back and see, like, okay, we ran this many trials. This is how many we got correct. So.
In fact, when we started tracking manding, when my son first started therapy, and you guys know manding, that's when the child requests, and you guys always wanted this insanely high number that I would go, what? How can that possibly be? And they all had golf clickers that anytime my child asked for something, it was click, 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 click. Because I don't even remember how high it was that they wanted to be per hour. I want to say it was over 100, and I was like, over 100? You want him to ask for over 100 things in an hour? My child who doesn't speak? What? But he got there, and there was no way that they could have been making hash marks and be involved with him and interacting with him. So the golf clicker really good thing.
That's something we don't necessarily think of as well. How many times do we ask for something during the day, even if it's not just asking for something physical, but for information?
Right.
What time is it? That's demanding for information.
Yeah.
So we don't necessarily think of those things just on our own, but of course your therapist, your behavior analyst is going to consider those things, especially when we're teaching children who don't have the skill to acquire it. And teaching words too, when you're first getting your child to speak. keeping track of how many words they're using a day.
Yes. I can remember, when my child was developing language typically, because there was a period of time in which he was, it was just so cool in the beginning, and he started saying words, and then, and there was a period of time when we were sort of keeping track of, and then it just exploded to a point where, people would say how many vocabulary words, I don't know, a lot, right? And then, of course, we lost language. He regressed into autism and got to the point where, the words just went away. And I remember at some point saying to somebody, I think the pediatrician said, well, so how many words would you estimate? And I said, well, and I could think of 5 words that he was saying sparingly, but they weren't to communicate. They were just words that he said, and I couldn't think of any words that he used to communicate. And it was fascinating to me. And then as we made the progression and got ABA, and he was adding, there was a period of time where it was 5 words a day, and then it was 15 words a day, and then it was, to the point where I wasn't keeping track anymore. It was that many different words. And then we moved into how many words were in the sentence that he was saying. Was he saying a 2-word sentence? And I remember when we made the leap to 3 words, and then to 4 words and 5 words and 7 words, and the first time that he ever just put 2 sentences together. So important to be keeping track of, because people will ask you.
And if you're taking data on that, you can say, oh yeah, today he said 3 2-word sentences.
Right.
And then the next day, oh, it's 5 now. And then you can just see, and it's, a lot of us are very visual, and you can see that on the graph. And it's something just during the day, if your child says these things, you don't think back necessarily and count on your hand how many words were in each sentence and what he said. But if you're taking that data, you can see over time, wow, my child's improving.
Yes, yes, absolutely. And eventually, just so you know too, then you keep track of how many back and forth interactions in the conversation. How many times can you go back and forth? And now I'm happy to say we're at the point where I don't keep track of that stuff anymore. We just have conversations.
That's so great.
It can get to that point.
Yes.
It absolutely can get to that point. Well, wonderful. What else is there that you guys see typically in data that really drives decisions that you make that are really, that we could talk with parents about?
You want to also look for stability. So,
stability? What do you mean by that?
And that means multiple data points in a row around the same level.
Okay.
So around 80%. Because if you have variability, 80% this day, 50% this day, etc., you're not going to end that program. You're not going to stop teaching that skill because obviously it's not learned. Stability is just over time, the child is performing at about the same level.
Okay. So in that case, having it, a flat line, you want to see some stability so that it's not going down.
You want to see stability, and of course for generalization across multiple people, multiple days, different settings, and then you can, at that point we assume, okay, this skill is mastered, we can move on to a different one.
Interesting, because I know as a parent, you like to see the spikes. You like to see things going up, but sometimes the spike, there's, a downward too. So you like to see things go up and stay up.
Yes. Or if it's some type of behavior problem, go down and stay down.
Yes,
because in that case, that you can see where that's very problematic if it goes down and back up and down and up.
Right.
So
that wears us
stability.
All out. Stability, having it go down and stay down. Although one of the things that we've been talking about today is that it's very common to take 2 steps forward and take 1 step back.
Of course.
It's a scary thing for parents. I drove our supervisor crazy because my child had skills and lost them. It was always my fear that they were the progress that we had was going to go away. And yet, she would assure me on a regular basis, no, we're never going back to that. We're just going to continue to make progress, but there are going to be some times that we're going to take steps back and we'll address that and move on, and it's not the thing to panic. I always think now of pizza dough. I always have to put it in other terms for myself, and how when you're doing a pizza dough and you're pushing it out to the edges, you put your hands up and it kind of shrinks back, but it doesn't shrink back to the original ball, but you keep pushing and eventually it stays out at the edges.
And that's really the importance of maintenance data. And so, you know, once you get reach mastery in a program and you maybe stop that program as the daily target, but we take maintenance probes.
Right.
So in like a month, we test that skill.
To make sure it doesn't go away.
Exactly. And if we test that skill like a month later and the child's performing now back down to 50%,
Right.
we have to reintroduce that target.
And that does happen.
It does. It happens all the time, and especially for skills that are important for everyday interaction. So conversation skills, those will keep building on each other, and you will never stop tracking those, because of course that's something you do not want your child to lose, conversation skills, and so you continue to track those skills.
But so important that everybody knows, even though that's something that happens on a regular basis, that if you are doing those maintenance drills and kind of checking things, then you just tweak some things, put it back in, and the child gets it again.
Yeah, and you'll often see that if, you know, a month later the child isn't performing at the level he was a month earlier, you can also compare how long it will take him to relearn that skill.
Right.
And you'll be able to see it takes a lot less time the second time around.
Yeah. We just went through this actually with shoe tying, because my son, it took him forever to learn shoe tying. We really had some difficulties with it. But eventually he had it, he mastered it and everything. That's great, fabulous. And then of course I, as the card-carrying parent, went and bought him a pair of shoes that had Velcro. Right? And then the next pair of shoes was Velcro. And then suddenly, recently this spring, he wanted a pair of shoes that had ties, because they had these bright neon green ties that he wanted. And I said, sure, absolutely, because we should do more shoe tying. And, you know, and thought to myself, yeah, because we haven't done that in a while. And of course, he had lost, he had lost the skill because he hadn't had any opportunity to do it for like 2 years.
Yeah.
So we had to reteach it, and I was very patient with it. I didn't push because I didn't want it to be adversarial, because it had gotten to that point with him for a while the first time. But he got it really quickly. He actually did. And now, you know, I imagine that there won't be another time, because I, as the parent, won't be buying the Velcro shoes for a couple of years, if ever. You know, so, but yeah.
And that's the case with anybody, with us too. If you know, you don't do something for a few years, you may need some help learning it again.
Right.
And that's just how we learn things. And you can't expect your child who hasn't tied their shoes in 2 years to just go back to it.
Yeah, I don't know what I was thinking. Well-intentioned parent, but not thinking. All right. Well, the time that we have you is up, but I want to thank you so much for coming in and talking to us about data, and hopefully you, like me, will be more motivated to take good data so that you can make informed decisions about what actually is, not what you think it is, not what you feel like it might be, and that you can also check with your provider to make sure that they're taking the best possible data so that your child, we want to be the most efficient, most effective, and we're not going to get there unless we're really taking the data.
Exactly.
And taking it well. And I find it just so fun that you get so excited about taking the data. That's just awesome to me.